order this meeting of the Board of Health for the town of Harwich, March 17th, 2026. Anybody, as required by law, the town may audio or video record this meeting. Any person intending to either audio or video record this open session is required to inform the chair. Anybody looking to record tonight? All right. And there should be a sign up on the back table. If you have not signed in, please do so. Public comment, food safety awards.
So if you'd like, I can read this so you can catch your breath and settle in.
Go for it.
Good evening. On behalf of the Board of Health, it is our pleasure to recognize this year's Food Safety Excellent Awards recipients. This award is presented to establishments that consistently demonstrate an outstanding commitment to food safety, regulatory compliance, and the protection of public health. These awards have gone above and beyond. These awardees have gone above and beyond minimum requirements, maintaining exemplary got it, inspection reports, implementing strong food safety practices, investing in staff training, and fostering a true culture for food safety within their operations. Food safety is not just about passing inspections, it's about daily diligence, proper training, attention to detail, and a shared commitment to doing things the right way. Even when no one is watching, these establishments understand that protecting their customers protects our entire community. Their efforts reduce the risk of foodborne illness, promote safe dining experiences, and set a high standards for others in the industry. They serve as role model for food establishments throughout our town. We sincerely thank you for your professionalism, partnership, and dedication to public health. Your commitment does not go unnoticed, and we are proud to recognize your achievements this evening. Please join us in congratulating our Food Safety Excellent Award recipients for their exceptional work and continued commitment to keeping our community safe. So our awards tonight go to Three Monkeys, Red River Barbecue, Milano's, and Buca's Tuscan Roadhouse. So good job to all, and thank you. We will make sure that these awards get delivered to their establishments.
All right. Let's move on to the minutes of the previous meeting. We have the meeting minutes for Tuesday, February 17th. Do we... Yeah, we have everybody here, so we can do that. Any questions on the minutes from February 17th? Any concerns, things to change?
Nope.
Everything looked pretty straightforward to me. Do we have a motion on the minutes for February?
Make a motion to accept the minutes. Second.
Second and vote?
Aye.
Aye. All right. Minutes for February 17th have been accepted. We want to push back the work session, Carrie, and take everybody else that's here first?
So if you want to move to old business, and then the second item in new business, the second item in new business, we're going to hold to the very end of the meeting.
Okay.
But if you want to,
So let's...
there are some folks in the audience too that I think that are here to listen to the discussion for the work session.
Okay.
So however you want to.
Let's move right to the work session then, if that's the case. Are there people here looking to listen in and discuss the synthetically derived cannabinoids and kratom ban regulation? Yes? Okay. So, prohibiting the manufacturing, sale, and distribution of synthetically derived cannabinoids and kratom.
And this is still just a work session discussion. This is not up for vote tonight to approve this regulation. It has not been posted. in the newspaper. It's just you have two model drafts in front of you. If there's any thought on which one you have preference on moving forward with. I think one has smaller fines with more first offense, second offense, and then the secondary draft has a first-time offense that's a higher dollar amount. So both drafts have been adopted in other communities. It's really dependent on how this board wants to move forward. Once we get to actual drafting language, anything can be taken out or revised or rewritten in any of these. This is not what's coming forward as a ban, just so everybody's aware. If there's anybody online that's here for this as well, this is just two drafts in front of you to decide if there is, I think they're pretty similar, written in similar fashions. It's just some things may differ, and I think that's primarily the fine structure. So if there was a draft that you wanted to see move forward into an agenda item that we would then post and discuss.
All right. Well, I mean, you know, after having a little bit of a look at these, you know, I mean, I know it may not be the most popular opinion with most people, but even as a nurse, I know marijuana itself is now legal here in Massachusetts as long as it's regulated carefully. But the synthetic cannabinoids and the kratom kind of open up a whole new, you know, category of things. And, you know, as much as I do and would support, you know, the natural cannabis distribution, provided that it's done regulation, I know that's not what we're here to talk about. And I, for one, I would like to see something come forward with the kratom, the synthetic stuff. I just, you know, for one, there's just, I don't think there's enough. You know, it's so new and but there are so many health issues that arise from it. You know, I know from speaking to nurses in the hospitals, they see a lot of people coming in even these days with hyperemesis, where it's just they're doing so much, they can't control nausea, and it's just really causing a lot of health issues. So any other, I mean, anybody on the board or anybody here in the public be opposed to the town drafting and adopting a prohibition of these cannabinoids and kratom? Is there anybody here that would like to speak to this matter?
I would like to speak. I'm on a Zoom call with you. I mean, I'm on a meeting with you right now.
Yep. Melody, go ahead.
Thank you. Thanks for allowing me to speak, first of all. I've been consuming kratom daily for 12 years now, and I've just returned a couple weeks ago from the University of Florida Research Center, where there were researchers and regulators from every single U.S. healthcare agency, and no one was talking prohibition of any kind except for an age gate. And of course, they want the testing for contaminants, just like any botanical is tested in the supplement market. No one discussed it, not even Nora Volkow, and she was our keynote speaker, the director of the National Institute of Drug Abuse. 2023 had a very favorable stance on kratom, and she talked at the U.S. Congressional briefing on kratom. And in 2024, she had a positive statement read into the record, and I was also testified at that. And the federal government is really looking to keep kratom legal. In July, they asked me to speak from their platform, from the HHS Joint FDA press briefing. They asked me to talk about its benefits as a daily consumer and to distinguish it from the synthetics, which I agree with you there. They eat the shelves. And so I just would really like you to follow that, because I'm a chronic pain patient. I've had it for over 20 years. And with I will lose my mobility and so will other chronic pain patients that, rely on it so they can have an active quality life. Summer, I spent 4 months chasing my granddaughter around from park to park, splash pads, you name it. Without Kratom, I would not have been able to do that. And so I would just ask you to please follow the HHS and FDA guidance on this. Keep the unadulterated products legal and get rid of the synthetics. And yes, there is a way to tell the difference as long as you have to have products registered in your city. So just please follow the guidance on that. The federal government is not interested in banning Kratom, not even the sale of it.
And Melody, where are you getting it right now, if I can ask?
Oh, yeah. I order it online. What I do is I take a deep dive into the vendor first, and then I make them provide me their lab results. And then I go and I do a deep dive into the lab to make sure that it's not some fly-by-night lab that will just say whatever anybody wants to hear. And I was on vacation like last fall. We did some touring around the country, and the place where I get mine from, I stopped there and asked them for a tour, and they were glad to give it to me. They took me through their whole facilities to show me all their stainless steel machinery and the packaging, and they showed me their inspection stickers, because you have to use that whenever you're making a supplement that someone is going to consume. They show me everything. So I just made sure that I did a really deep dive, and the same occasional, I'll switch vendors maybe for a cheaper price, but not until I do a deep dive into their labs and everything else that it entails.
Well, for one, I applaud your diligence on, looking into individual locations that you happen to be purchasing from. Secondly, we're not, we're only discussing manufacturing and distribution here within the town of Harwich. If you're ordering it online for your own personal use and you are finding health benefits from it, more power to you. That's your own personal use. But we're talking about, banning the sale and distribution of it in stores locally. Nobody's saying that you can't go online and order it. And again, most people are not doing the level of research that you are doing into where they're getting it from.
I understand your point, and with the sales, and you're going to hear from Misty Brown probably very shortly. She is someone who found Kratom after she had become an addict. And how did she find it? In a smoke shop. And she would not have been saved if the sales were prohibited. But I'll let you talk to Misty about that. I see that she's on here with me.
Misty, do you have something you'd like to add? I see your hand waving there.
Sorry about that.
No, that's all right.
Yes, as Melody was saying that, so I was an active addict for 11 years straight. I suffered from substance use disorder. My addiction started, via chronic pain management, after I got diagnosed with degenerative disc disease in my back and hip. And when I got fired from my chronic pain management in April 2019, I went to the streets and I started doing cocaine, because I rationalized with myself stating that, snorting cocaine was better than shooting heroin in my arm, because shooting heroin was going to be my next step. But in the midst of my cocaine withdrawal, I watched that documentary called A Leaf of Faith in June of 2019. The very next day was when I walked into the smoke shop and I bought whole leaf kratom powder. It was locked up in a glass case, sitting behind the counter, and I had to show my ID to get it. And that's what started my pathway to my recovery. Now, I can proudly say, here I am over 6.5 years later, I am a proud, recovered addict. I don't live in that mindset of always going to be in recovery. I know not everybody thinks that way, but that's just me. I'm no longer my label. And, now I utilize it for my chronic pain, for my anxiety, for my depression. I haven't been back to pain management over 6.5 years. You know, there are tools put on this earth for us to utilize. You just got to figure out how to tap in and do it. And so by banning the sale and distribution of kratom, whole leaf kratom in your community, you're taking somebody's lifeline away, you know, you know, somebody would be accidentally walking in, you know, whether they're suffering from illicit fentanyl withdrawals or heck, the 7-OH withdrawals. You know, we don't want 7-OH on the shelves. Ban that. That's synthetic. You know, you're talking about synthetic cannabinoids. 7-OH is pretty much like K2 spice is to cannabis. You know, it's synthetically created. Get that off your shelves. You know, we know by testifying in these communities that what we've heard is that whole leaf kratom has been replaced by synthetic 7-OH. So if you're having problems in your communities, it's the synthetic stuff. So get that off your shelves. I agree with that. But, you know, save the whole leaf kratom powder. But yeah, thank you for allowing me to testify. And if you have any questions, I'll be more than happy to answer you. Oh, and by the way, I'm not paid to be here at all. You know, I've heard that before. None of us that are on this call are paid to be here. We're just passionate advocates. I, too, also attended that kratom symposium that Melody was speaking about in February at the University of Florida. And that was fascinating. You know, when you have people fly, hundreds of people that flew in all around the world to come in there and talk about the emerging science of whole leaf kratom and the damaging science that 7-OH is, you would be mind blown about what we learned. But yeah, I'll be happy to answer any questions you got.
Then for Melody or Misty, you know, with your current use, and again, you know, a proponent of marijuana use and its benefits, people with chronic injuries, you know, a lot of people on high doses of chronic pain meds. And I know, you know, there are a lot of other safer options that can be there. But, I mean, an honest opinion of either of you who use kratom for, you know, seemingly beneficial reasons, have you had any difficult obtaining it? Like, is it gonna ruin your day if you're not able to get it? I mean, Melody, you seem to be ordering it online and doing due diligence. I mean, do you have any issues obtaining it, even if you're using it for appropriate use?
No.
Any problems, but somebody like Misty might not be around. And we need to understand that these are, if you ban sales, there is no regulation. The products aren't going to disappear. They're just going to get worse. And by putting regulations, by reasonable guardrails, the thing that you're trying to protect is that the underage, the contaminated products. If you ban the sales, you're still not protecting, people are still going to get them. And you won't be accomplishing your goal by banning the sales of it. In fact, in my opinion, and which was also the opinion at the conference or symposium, nobody talked about a sales ban of any kind. And if kratom should have been gone, I mean, why would they ask me as a 12-year daily consumer to speak from their platform if they thought, yeah, it's a good idea for cities to ban it, though? I mean, I'm not like Misty around.
Yeah, like for me, what I like to think of is, you know, the grandma and grandpa, you know, the older generation that consume, you know, whole leaf kratom, but they have no idea how to order it online, and they've just been going to the shops for years upon years, you know, to go get their powder. You know, I think about people like those, and due to the opioid epidemic that I survived the overprescribing part of the opioid epidemic, now there's an underprescribing. You know, chronic pain patients are being cut off left and right. And the stories, like, to know that I played a part in that, you know, it eats away at me. But I always say, you know, the people that are being underprescribed today had no idea what it was like during my 11-year addiction run, you know, to be overprescribed. But, you know, I don't know. I just think about the people that don't know how to order online and the people that already have an established routine of just going into their shops, you know, and buying their powder and being able to go garden, you know, or walk their dogs and stuff like that.
Is there any data as far as stores in town that are currently selling kratom?
So we've done a little bit of research. We do know that it is on the shelf of some stores. We haven't been to all of the establishments to check. One of the things that I would like to point out is the information that we have is that the FDA has warned people not to use kratom. And they're not talking synthetic kratom, they're talking kratom of any kind. So there's no studies that support the health benefits, but there are a lot of reports of people showing up at the emergency rooms with overdosing. Some of the concerns that they're seeing in some of the manufactured products is that they're taking that beneficial substance from the plants that they derive from, and they're making it more potent and more potent and more potent. So the doses are getting stronger and people don't always react well to them. So until there is and again, if there are health benefits to this and people are working with their primary care doctors and are able to get it through their primary care doctors under a prescription or through a licensed supplier, I think that would be the more appropriate place to receive these products than on a convenience store shelf. That's just my thought on, especially where the youth is the concern. And the youth, if we can prevent youth using these types of products in our communities, hopefully we can prevent them to getting to the point where they're, in Misty's situation. I know Misty's a little different where it's an overprescribed from her primary care doctor, but hopefully there was a lesson learned through that pandemic as well. That was wreaked havoc on our communities, and I would hate to see that duplicated where we could control another entry level into that.
I do think I see some other hands waving here online. Jennifer, Jeff, and Shannon, I've seen all moving. So, Jeff, you see your mic is on,
Yep.
and I can see you. Let's start there. And Jennifer
I'm
and
here.
Shannon, we will get to you as well.
Well, thank you so much for hearing from us. I don't want to preach to the choir here. You guys sound like you know what's going on. Like Melody was saying, the ban is not the way to go. Let me just give you my story, and you guys can go from there. Once again, a lot of people have already made up their mind. It's bad. Okay, get rid of it. And then, like Melody and Misty were saying, people like us don't have anything to get rid of our pain. Degenerative disc disease, osteoarthritis, sciatica. I had an operation, and now I'm getting around with the aid of kratom of that operation without my walker, and I'm helping the wife do chores now, and it's just wonderful. But it reduces my pain. One of the good deals about it is I was it's even awful for me to say this. I was an alcoholic, bad, lost marriages and won. Anyway, you don't want to hear all the stories, but I quit going in my refrigerator to get wine and beer and everything else just by taking this kratom for pain. So it got rid of my cravings for wanting alcohol. That was my drug of choice. So that was, golly, I don't know what I'd like more, the not craving the alcohol or not being in pain bent over double. So, wow. It's just, I won't buy my kratom without a good manufacturing practices on it. Now, you can go online, and I'm like Melody. I do my due diligence. I check their lab stuff, make sure that, there's no heavy metals, there's no biologics, and the 7-OH portion of it is what they're jacking up. That's what they're taking from kratom and synthetically expanding it and making it something that's not even kratom. They're saying it's kratom. It used to be kratom maybe, but now it's not at all. They're just using the name kratom. And that's where the disconnect is. People are getting hurt off of this stuff that's jacked through the ceiling. And
So you
these
can
poor
understand
kids, they
our
don't know.
concerns about it then.
Oh, pardon me?
So you can understand our concerns about it then.
Absolutely. Oh my gosh, yes. Yeah, you don't
Go
want
ahead.
this trash on your shelves. Absolutely. But if you've got good green powder that tastes like you took your grass out there, ground it up, dried it, and drank it, that's about the way it tastes. But the benefits are there, and I don't know how much you'd have to drink to. If you tried to, I would imagine you'd throw up because I have to have it on a full stomach because it's gross. It's just horrible. So that's what and I make sure that it's like I said, lab tested, GMP. But if I run out and I go to these stores, they don't know what they're selling. So they're selling the 7OH nonsense, and there's all kinds of different stuff.
And
like
most
the
people
synthetic.
walking into those stores to get it, Jeff, are not doing the same diligence that you and Melody seem to be doing, which again is applauded wholeheartedly.
Well, I don't know
Most
how
people
you'd
aren't
come down.
doing
I'm not
that.
on the regulation portion. I don't know how you'd come down on these places, just like you would cigarette sales to minors. However you do that, that would be the same type of regulation. But I don't know. I don't think banning would do any good because you get poor people. There's millions of people that take this. I didn't realize that. I thought it was just me until I found out about this, and I don't get paid for this. I'm in Virginia, but I hear that something's going on. They're going to ban it. And I think of all the poor folks that don't know anything about the bans. They think that, hey, I found something that works. But no, next week, they don't know. It could be gone. So that terrifies me. And that's why I say stuff like this, to help the folks that don't know about it or are so jacked up with pain they can't. So anyway, that's kind of where I am. And they've got regulated products, the Kratom Consumer Protection Act at different states. And all these people you've talked to, I've been in this game a lot longer than I have, and they've got the paperwork and the studies and everything, if you ever needed anything to know about Kratom. But I just wanted to thank you all again for listening to our stories, and it's very, very important to us and a whole lot of people I know in your state. If you have any questions, I'm here.
All right. Let's get some comments from Shannon and Jennifer. Shannon, let's start with you.
Hi, can you hear me?
Yes, we can.
Hi, good evening. I'm Shannon, a lifelong resident of Massachusetts. I just wanted to say there are a lot of people like me right here in Mass that are terrified to know that people will suffer in pain if natural whole leaf kratom is totally banned. I do agree with Melody and Misty about at least keeping the natural leaf kratom powder in stores and just totally getting rid of the 7OH. That's what we have to worry about. The natural kratom powder, like Missy said, a lot of people, they don't order online. They don't know, or if they're elderly or older, they just, I'm actually a healthcare worker and I work with the elderly, and they wouldn't even know what to do, but they know they can get in their car, go to stores and get the natural pain relief that they use daily. Banning it just doesn't affect just the state of Massachusetts, but our whole country as a whole. The chronic lower back pain I experienced before I found whole leaf natural kratom, I cannot even begin to explain what I went through. Again, I am a healthcare worker, and I can't imagine going to work in agony, especially working with the elderly, lifting them up. That's what's wrong with my back now. Please, instead of banning natural kratom, please looking into regulating it. Our neighbor, Rhode Island, actually banned kratom in 2017 fully. They did the scientific research and they reversed the ban in a couple of weeks as of April 1st, 2026. The FDA also announced in their July 29, 2025 press conference that they are not interested in scheduling kratom. They only want to ban the synthetic 7OH. Right in Massachusetts, South Hadley and Amherst, they did pass their regulation to keep natural kratom have access for a lot of people, and they did ban 7OH, so people have access to that in stores. If you can follow maybe their ordinance, ordinance of what they did, and that would help out a lot of people. Like I said, I've been taking this since 2017, and if I wasn't able to have access to natural kratom powder, I wouldn't be able to work. I'm 42 years old. I've been a CNA since I was 22, and I'll tell you right now, it's bad. The pain is so bad. And if I didn't find this natural leaf kratom, I'm telling you, I don't even know. I talked to my doctor. We sat down and I told him the pain meds that he had me on, they just didn't work. You know, they worked a little bit, but then it's like, all right, so here we go. Now I got to take more. And I sat down with him one day and I said, I said, Jason Diago, listen to me. I don't know what else to do. I did find natural whole leaf kratom powder. And he stopped me. He said, Shannon, I have like 9 to 10 patients that have that. And it's like, it's a miracle. And, he goes, I don't know much about it, but if it's helping you and you're okay with that, I've been telling all my patients the same thing. And it does. It helps so many people. So, I mean, if you could, like I said, if you could just keep it regulated, the natural kratom powder, and get rid of that synthetic addictive 7-OH, that's the problem. Nobody had an issue with kratom powder until 7-OH came about. I believe it was like 2 years ago, 3 years ago. And, if you guys can regulate it, it would help so many people. Thank you for allowing me to speak tonight.
Welcome. And just to make sure we hear from everybody that wanted to speak, Jennifer, last but not least. Jennifer, are you there?
Just gonna unmute.
We cannot hear you, Jennifer.
Nope.
No.
We will be speaking on this again next week if Jennifer can get our microphone working for the actual hearing on if you want to enact a ban or not. So, or not next week, but next month. So if Jennifer is having technical difficulties and can't speak tonight, it's not like we won't be able to hear you at some point during this process. Okay. She
Come
seems
speak to us
satisfied
in
with
person
that.
next month, Jennifer, absolutely.
You can always call in too if, and use your phone for next time. Just have that as a backup.
All right.
So,
Is there anyone else here who would like to speak on this or has anything else to add to the discussion? And again, currently, this is just an open discussion. Nothing is happening tonight. There's nothing being voted on tonight. This is just a work session where we're batting it around. Does anybody else have something that they want to speak on this evening? Nothing to add over here? Okay, okay. Fair enough.
so one of these is more prohibitive in what the products that it would allow to be on the shelving. As well, I just noticed that this one has the unregulated novelty intoxicating products. So that has a larger capture and what it's taking off the shelf. This is also the one that has a different fine structure. So we can always take things from one, add to another if there
Make
if
it
there
our
are
own,
things,
like,
if you want to do a little bit more deeper dive into the 2 drafts.
I do definitely, and I mean, as far as, I still need to do some more research on kratom itself. Just like nothing.
Would it be worth the board to have more of a professional opinion? I mean, this is a pretty significant decision. I just wonder if we should have more of an expert.
So we can get Bob Collette to come in. He's the tobacco control specialist for the Barnstable County. He's done a lot of research on this, so I think he would be a good
Be
person
possible
to
to
ask.
arrange that next month?
I could reach out and ask
We have
him.
an awful lot of subjective stuff, but nothing objective.
I also sent you a link to a webinar that had information on Kratom if you wanted to. It's recorded, so you can go back and watch it.
How would do that? Yeah.
But it's something that has a lot of, it's primary care doctor, physician that is hosting that discussion, so, and that was directed towards regulators and public health professionals, so I would definitely think that the information provided in that was of some,
Oh, good, thank you.
And just for everybody who's listening, I mean, I don't disagree that the majority of the issues come from all these synthetically derived products that are being manipulated. So it's definitely something that we're gonna look into further. I think if everybody's had a chance to speak, we will move on from this tonight, but please get Bob in here next month to give us some more insight from a professional standpoint.
so we will, if Bob is unable to attend the next meeting, what we can do is just postpone the conversation until he's able to attend our meeting.
Okay.
So, when we do move this for further discussion and draft for everybody who's listening, we will post in the newspaper. We will also notify our licensed establishments that it is coming again, so you won't be blindsided. You'll have an opportunity to speak on it. Yeah, so we'll go from there.
All right. Let's move on then to old and unfinished business, continued from January 2026, violation appeal request for 71 Main Street Extension.
Evening.
Hello?
Evening.
Ricky, I'm the owner. With me tonight is Bruno Demare, the owner of Reflections Auto Body, located at 4 Evergreen Way, which is a nearby property. Thank you for continuing the meeting in January. I know that there was a lot of material supplied. I just want to briefly review that presentation. That 248 CMR continually refers in its language to parking garages in the city of Boston and the MWRA. I know that the issue raised by Chuck Bortzel of the Division of Professional Licensure regarding any building constructed with an overhead door was raised and addressed in my letters back in August of 2015, which I said was an excessive overreach. And if in fact that were required, then hundreds of industrial and metal and commercial buildings in the town of Harwich would be required today to install tight tanks. As I stated on January 20th, 2026, the language does not differentiate between commercial or residential either. So my argument position would be that would also include any residential property that has an overhead door. So the regulation in and of itself is excessive. It's also very costly. A tight tank is a very costly installation. And from my perspective as a developer and owner of similar properties, they don't make any real benefit. As I've discussed in the previous meeting, there's just no benefit because the language of 248 CMR specifically is referring to the drippings, more or less, of frozen ice that comes off of vehicles in Boston garages. So the part of this that's backwards is if my vehicle is parked in the bay and the material is contained on a concrete floor, to me, that's safe. But regardless of a tight tank or not, if the vehicle is parked on a slightly inclined parking space, which typically is the way entrances to all buildings and how homes are, created, it can go into anywhere. So there's no logical sense to this particular regulation as to stating that you need a tight tank. Now, all that said, the issue comes down to use, and I understand that. The current use, as stated, I provided at the previous meeting 2 notarized affidavits that the current use is not that of what is described erroneously by the septic inspector in his report, which septic inspection passed, he referred to as an auto body. That is not the actual use. The use is that of a fabricating shop. And with that said, I'm going to defer to Bruno Demir, the owner of Reflections Auto Body, which is specifically an auto body use, to discuss why a tight tank is not required for even that use, which is not the current use. So,
Good afternoon, folks. I also own Cape and Islands Mitsubishi in Yarmouth. So I have experience in both mechanical repair, where you would need a tight tank, which I have, and auto body, which is Reflections Auto Body. 5-star Google review, so if you ever need body work, we're in
That's not a
Harwich.
plug.
But so I have experience in both. I've been in the industry for 25 years, and the reason you need a tight tank when you do mechanical repair is because if you ever spilled the oil from the car during an oil change, let's say, by accident, it has to go into something that drains out into an oil tank, right? If you have a body shop, you don't need a tight tank. What you need is a spray booth, right? And you need a license for that spray booth, which I am, just to make it clear. So that's why you would need one or the other, but you don't need a tight tank if you're doing auto body, because you're not allowed to do anything mechanical, which you don't. Now, in this case, I feel really bad because Rick asked me, do you have a good septic inspector? I said, I do. He just inspected the building my body shop is in. So he does the inspection, right? But on the template, he used the same template that he did for me and never changed his inspection that for a body shop. So when he submits his inspection for 2 buildings, 71 and 74, he puts body shop on both of them because he never changed the template when he was doing his inspection for me, because he did it literally weeks after mine. So he sends it to town. The town's like, wait a minute, there's no body shop there on our end. What's going on? So you have to do your due diligence, get out there, see what the heck's going on. That's where the whole screw up was. But Patriot Auto, if you drive by there, you'll see a 1947 Ford, a 1979 Chevy, a 1962 Ford. What he does is very specific to my industry, and I actually use him for a lot of this. He fabricates stuff that you can't buy. So in other words, if I want a fender for my 3-year-old Ram, I just go online and I order a fender. But if I need a fender for a 1964 Chevy, you can't just buy one of those. You have to custom fabricate that through welding and someone that specializes in that. Think of like that motorcycle show that got famous, right? So he custom fabricates those parts. One time I had a Ford that had a broken frame. You can't just fix that. I brought it to him and he welded. He's one of the best welders in town. He does zero auto body because he makes me paint some of his stuff in my shop. And I think he even passed in a letter from Northside Auto Body, who also does a bunch of his work. And occasionally he's had me do some mechanical work for him because he doesn't have the capacity to do mechanical. It's strictly fabrication. It's all welding and beating metal to get it to fit. And a lot of it is classic cars. And that's where the whole mix-up was. So putting a tight tank in there is it's overkill. He doesn't do anything mechanical in there, you know? Now, I will say this. You're going to go on his website, he's going to say, we offer auto body work, we offer mechanical repair. Well, that's a very standard thing in our industry, where I might advertise I do mechanical repair in my body shop because I'm going to subcontract that out and make a markup on the difference. It's very normal to do that in our industry. But
And you also understand then from our perspective where we're seeing a shop that isn't set up for that, yet that's what's being promoted as the business that's being run out of there. And yes, you're saying it's gonna be subcontracted, but you understand from our perspective, the kind of, where that puts us, at least with the initial filing in the report.
Sure, sure. No, I get you had to do your due diligence to get out there, but, I mean, he even marked the other building as a body shop, so you could see where the screw-up was, but at that point, it was already submitted, and you need to do your due diligence to get out there. But if you drive by there, you'll see they're all classic cars, and they're there because he's fabricating stuff. Like mirror for a 57 Chevy. I mean, this is what the guy does all day long, And he's been there for, forever. Everyone in town knows him as one of the best welders for fabrication of motorcycle parts or classic vintage cars.
So in summary, I realize this is very complicated for you folks. There's no doubt about it, because a lot of this is driven by the state, and I understand that. But there is a hardship here, and there is certainly an issue of, the inspection, which was really erroneously described. If it had been described correctly, we wouldn't be here. And we did.
Probably not.
We did get relief on 73 Main Street without any issues. I think we've done a lot of work. I've certainly presented enough and a lot of information. And just at the end of the day, I asked the board to look at this independently for what it is in fact and in reality. And, once again, the septic inspection did pass. And I simply request that the notice of violation be rescinded for 71 Main Street Extension.
Anybody with any comments on the board, questions?
I mean, the only thing is that the website could be cleaned up a little bit. I mean, yeah,
As far as the promotion of the business,
yeah.
if it could be like amended on the website that these services are offered, but, dispersed out to other
Word it
subcontractors.
differently, yeah,
Could
sure.
word that
Because
differently.
it's confusing for you guys. You guys look at it.
Absolutely.
You're not in the industry. You assume this guy's painting cars in there, so I get it.
That would be my comment.
The owner of that business is currently, he's a musician. He's currently out of state, so it's not like I can ask him tomorrow. I suppose I could call him. But certainly that would be reasonable. And I have had that discussion with him just based on what the description is. Certainly could be cleaned up quite a bit.
Like, we can offer automotive repair through our partners.
Would be great.
Yeah, so
Something
he
as
can
simple as
still
that.
offer it, but it's much clearer for the legality of it. I get it.
Given the affidavit here that we have, that that type of work is not being done currently in the facility. I would be willing to move past this myself, with the realization that, that type of work cannot happen in that facility unless there were to be changes. And yeah, if the wording on his website, so that when people go to look at what's being done there later on down the road can be cleaned up, it would certainly, I think, be a benefit to everybody involved.
Sure.
Just for the record, as I stated in January, I'm not opposed to removing tenants when they're not, doing the right thing. So I'm certain that the tenant would be willing to address that.
Yeah.
And we
It certainly doesn't have to happen
We'll all move
tomorrow.
forward.
We know you gotta make contact with them. I'm not
Bruno-
asking for a snap of the
This
fingers.
poor guy
Bruno's-
probably doesn't have the password to his website. It's gonna take him a week to find it. But we'll get it done.
Okay.
Yeah, anybody else? I mean, I know you guys are here, just within the half. Is anybody else here to discuss this issue or has anything else to add? No? All right. With with no other questions from the board, you know, I for one would certainly like to put this one to rest, and move past it. Again, with the understanding that, like, let's get that verbiage eventually changed on the website, and know that, should it be discovered, I don't expect it to.
Sure.
But that those types of operations are happening in that facility, that this would then certainly need to be revisited.
Sure.
Okay. So, I mean, for one, I can make a motion myself, right, Gary?
Sure can.
For one, I move to approve the appeal of the order to install the floor drain and holding tank at 71 Main Street Extension with the following conditions: that pumping shall be conducted as needed, and that the approval letter and conditions must be recorded at the Barnstable County Registry of Deeds.
So that would be if you were going to uphold the order. If you were going to uphold the
Approve the appeal?
approve the
Okay.
appeal, there wouldn't
I'm
be
a little
any
confused on the
conditions on,
verbiage
yeah,
then.
yeah.
Okay.
So it would just be, I think, modifying the language on the website. And then we can get, Mr. Hamlin an updated letter to accompany his Title V report tomorrow. So,
I think that's fine.
so if you want to move to uphold or approve the appeal.
Just for the record, when you say pumping, you mean the septic system itself, the Title
Right.
V.
No, so those conditions don't apply to the motion that they're actually
All right, I
making.
understand.
Yeah.
But as you know, I do that every 2 to 4 years anyway.
Yeah,
so.
this would be if there was the requirement of the tight tank,
It
then that
was.
would be necessary to pump
Okay,
as
thank
needed.
you.
Yep,
All right, so we're moving to approve the appeal
correct.
for 71 Main Street Extension. We have a second of that motion.
Second it for 71 Main Street, yep,
Vote?
aye.
Aye.
Thank you very much. Appreciate
Thank you,
it.
gentlemen. And I appreciate your patience. Looking a
don't
little
forget-
further, I know you were here
Don't
in
forget-
January.
5-star reviews at Reflections Auto Body. Harwich, Mass.
Don't, we got all the website screenshots in here, so.
By the way, I learned an awful lot about Kratom tonight.
Oh, yes, please. You didn't have to stay through that whole thing.
Ate there recently too for,
She is too, yeah.
Oh my goodness, he was just so patient.
He had other interests too, so.
Oh, okay, all right.
Okay,
all right.
Moving
Moving on to new business, citizen petitions to go to town meetings, second generation anticoagulant rodenticides, fertilizer reduction, designation of scenic roads, regulation of leaf blowers, and tree preservation.
Yes, good evening, Patrick Ott. Glad to be here to discuss any of those above citizen petitions that the Board of Health feels is appropriate to take under consideration.
so these were presented last night to the select board on whether they were in favor or not in favor. I did not make note on which ones they supported and which ones they did not, but this is being presented to you in case you had any insight. I know that the fertilizer has come up and pesticides have come up in the past, and I think that we're looking for a reduction, not an overall ban in these instances. We did have conversations, I think, with Patrick earlier in the year, or late last year, and you were open to further discussion on the fertilizer reduction. You just wanted some input from,
People in the industry.
the industry. But this is a citizens petition, an article that is moving forward to town meeting. So you really don't have anything that you have to vote on or approve or support. If there was anything that you did want to weigh in on your support or non-support of, or have any questions for Mr. Otten, now would be your time. But don't feel like you have to make any decisions or This is nothing that we're making any motions on. It's just for your information, and if there was any insight you wanted to provide. I know one of the concerns from last night regarding the second-generation rodenticides was what the Board of Health input was in regards to, that,
It's not, if you stopped using eschars, what's the effect?
right. So if there was a reduction or a ban on eschars, what would be the public health implications? And I think, the concern that I have is limiting tools in the toolbox when you have an issue. And I think that this petition addresses our ability to be able to still pull from that toolbox in an emergency situation. So it does address some of those concerns. I think there's always room for improvement, but this is a much better petition than was presented to us in the past from my perspective, just on giving us some leverage without ruling it out completely. But I think, again, there's always more research to be done.
I think we're being used in a controlled situation by a licensed professional. And I think it's a necessary tool in certain instances.
Yes.
Currently, that is the requirement from eschars. It is not available for public use.
Yes.
The consequence of eschars is it's propagating up the food chain. You poison a mouse here, you kill the fox here, you kill the coyote there, you kill the owl later. Let me just fill in some blanks. This is of significant enough importance that before the House, there is now H 5217 and Senate Bill 2721 that are addressing this exact issue. So it has gone from 32 municipalities within the state asking to reduce the use of eschars. It is now before a statewide reduction, or I'll use the word ban. I haven't read their wording of their individual. So again, what the home rule, it is a home rule petition. It's asking the state to allow Harwich to have a stricter use regulation of eschars than the state.
It's asking for permission for the town to come up with its own regulations.
No.
This would be the
Is that-
language that we would adopt.
Okay.
There is a bill in front of the state, and the bill is essentially a ban, but it does give and I'm not sure if it's going to be on a state level or on a local level, that gives us the ability to approve the use of it in emergency situations as well. So very similar to what's being presented with some other.
And when is
Differing
this
language,
going
but-
before the state?
So this is going before town meeting. So I have a feeling that the board members and/or the department is going to be asked to weigh in on this at town meeting. So something that we should look into. I know that the public health concerns with not using it, for our perspective, is rodent population growth and the disease that rodents carry. But depending on how frequently it's used, I don't know that we can measure that without studies being done. So something I am looking into to see if there have been any studies in areas that have enacted bans and what that means, but I don't know that we have that data.
Correct.
To present.
It hasn't been banned.
Right, so
And
They're-
I mean,
they're looking for
I
answers
know
that.
with all the septic work going on, as we're digging up all these areas and displacing a lot of these animals, they're looking for new homes and finding it a lot of times in, residents' homes. So I feel it's been more and more of a problem since all the septic work has been going on. I've had a few get into the garage myself. We try and deal with them with traps, individually, one at a time, and, it's an ongoing battle. Sometimes even, I
There
feel
are
like I'm losing
alternatives.
it. Yep.
There are alternatives. There's also been cases of children being poisoned by these escars because they're a shiny little pellet and kids see it and they eat it. And there's been cases of children poisoning.
So I think there's both sides to look at. I don't think it's something that should be dismissed completely, but I do think that if we do get something in place, we want it to read correctly, so. And I think this is a lot closer than where we were before, and it would be interesting to see what happens at the state level, because this might be kind of moot.
Correct.
Anyways,
If
if
it passes
they're
in the
gonna-
state, this is moot.
Yeah.
Right.
Right, which is why I was asking, when is it, do we know when
No.
it's being brought to the state?
It, as you know, state legislation's forever. But the important fact is that, in fact, there are now the two bills, one in the House and one in the Senate, doing exactly this. When it comes to fruition, if, when, and how, we don't know.
Okay.
I know that it's been felt pretty strongly by this board in the past that, not limiting the tools in the toolbox. But I think there's a way to work with a reduction, which I think is what Patrick's proposing this time. And education, which we did, again, we did have that best pest management and soil nutrient education series that nobody attended, and we are gonna try again this year. So hoping that we can get that information out to Patrick, and Patrick can help spread the word on our education efforts, because it is important to educate, because it's the homeowners that do end up with these products that aren't applying them correctly.
Fair enough. Very good. Good work.
Another one that may concern you is the quieter neighborhoods regulation of leaf blowers. I don't know if that's a Board of Health concern, noise.
Noise is, but ambient noise and noise levels are, as far as exposure risks, the concern would be more to the person who's operating the leaf blower than the neighborhood that it's blowing in. Just for the level that they have to reach, for the amount of time they have to reach on a consistent basis for them to pose a public health.
I used to frame houses, and we run all kinds of equipment doing that. A leaf blower that somebody has or a company uses, as long as it's not, I believe before 6 o'clock is the regulation for as far as like noise, that's like builders can start in the morning.
There's no time limit.
No.
Reading Chapter 189, noise, it simply says plainly audible above routine and normal background. Plainly audible at 150 feet, and it includes lawn and landscaping equipment.
I think with all the trees have fallen, I think chainsaws are going to be the noisiest.
Gonna hear them, yeah.
The noisiest part of the cleanup.
There are several towns, if you do the research and look, several towns do have bylaws limiting, one, the type of leaf blower. Typically, your gas-powered are the noises, 120 dB. Your quieter electric leaf blowers are below 70 dB. So towns are working in the direction of, let's have leaf blower noise be less than 70 dB. Just
And, your concern is just like the fact that it's ambient noise, or are you concerned about anybody's hearing damage? Because, this is one that would be a hard sell with me, Patrick. A very hard sell, I'm not gonna lie. And it's not that, I wanna listen to leaf blowers all day, but how often do you really hear it going? It's not, you hear noises, I hear people, roofers firing their guns to put a roof down. It's just as loud as a leaf blower that I hear a couple houses down. I just don't, I really don't see this one.
I find it disturbing. I'm walking in the woodlands of Wisconsin, and over there's a leaf blower, 2. Now there's 3 going. Over here, there's more leaf blower. I said, what am I doing here? I wanted it quiet, and, they're a quarter mile away. So there is definitely, well-being and peace. Other petition or bylaws limit the days of use, limit the hours of use, limit the type of equipment of use, just to have a quieter neighborhood, just like we have noise regulations on Main Street, you know, at Harwich Port. So, just FYI.
I hear you, but yeah, this would be a hard one for at least me to support personally.
Well, there are 120 decibel leaf blowers, and there are 70 dB leaf blowers. Which one do you want running next to your house?
Again, I can't say it's ever bothered me personally. I mean,
Okay.
All things to come out on town meeting floor,
Yep,
so
yep.
that's, that Patrick just wanted to bring these forward to the board to
Yeah.
discuss, see if there was any input.
And the other one that has been brought up now for 4 years in succession is the fertilizers, not to use fertilizers. I'm approaching it a little bit differently. Yes, the environmental impact is still there, but if you look at fertilizers and the contribution to nitrogen in the environment is 15%. So sewering is slated to be $200 million for Harwich, all right? If you take 15% of $200 million, what is that? I wrote down the number. That's $30 million. So if you stop putting fertilizers on the ground and don't have to spend $30 million out of our pockets, that's quite a significant cost of taking care of our environment. So I'm just introducing one more aspect of how to look at fertilizer use.
yeah, and I know it's come forward many times.
Yep.
And I'm not opposed to working with the people in the industry to, come up with better, but I mean, none of them have been involved in this discussion, and I think I made it very clear that I wouldn't move forward on anything unless they were involved in that discussion and I had a chance to hear from them. I do have, multiple friends in the industry who I haven't spoken to in any great detail, but have also indicated that use of nitrogen could be reduced with similar results. Again, I think the use of it, when done by a licensed professional who's using it in the right way, and I know I've heard the argument before about, the houses that are being used 3-4 weeks out of the year, and they're hiring a professional to come and do it, and yeah, that's a lot of. It's a tough area to try and manage, Patrick, and I hear your argument for that.
Yeah.
And I would want the nitrogen runoff affects everybody, whether it's from fertilizers, whether it's from the septic. And there are also a significant number of people where if we were to introduce any kind of ban, an outright ban on fertilizers, the implications on their, ability to make a living on many people in this town would be severely damaged. Which is why I would want those people who, it's gonna affect all of us, but those people who would it affect most, I would want to be as part of the discussion.
There's also a change in perspective. Fertilizers are primarily used on urban lawns, which are not native. So converting your lawn from an urban lawn into a Cape Cod lawn, a pollinator lawn, is far more work for the landscaper to maintain, to put in and sustain than having True Green come in with their spam email that I've gotten 7 so far saying, sign up now, get your 50% discount, and we guarantee your lawn will be greener than your neighbor's. So you're right in general, but let's shift the perspective from green lawn to what is natural and normal for Cape Cod, a Cape Cod lawn, a pollinator lawn, or where it is that we live. So, so yes, there are arguments about costs and benefits, but we also need to shift our perspective.
I get a reduction I'm okay with, but as far as how far that reduction goes, like I said, I want those other people involved in that conversation.
And this one says it is reduced. You can use it on your gardens, your flowers, your trees and your fruits and your vegetables, but not on your lawn. So, but no change from last year. Is there any interest in any of the other petitions you have a question on? Scenic roadways? Preserving trees? Yeah. You could argue that there is a health benefit to having trees in your yard, to having scenic byways for your aesthetic appeal, so, you know.
It all can be tied in somehow to public health. There's always a way to merge public health into
Yeah,
any way that we connect with nature and any way that we connect with our environment.
and that's basically what I'm doing, you know, so. All right, and, you know, again, this is just FYI, right? Don Howell did make the criticism or comment to me on the fertilizer one. He said he would not support it because it's not coming from the Board of Health. I said, really? It's a citizen's petition, Don. That means a citizen can do it. It didn't say the Board of Health has to do it. But it was interesting that he made that comment that he wanted your input on the fertilizer. So. And he's going to expect your comments on the SCARs too. So.
Yeah, I did take note, I watched the meeting today, and I did take note of that was probably something that we'd be looking for input, so we may want to at least have a discussion on those two petitions prior to town meeting.
Can you send me the link for the meeting where it was discussed?
The select board meeting
Yeah,
from,
select board meeting? Thank you. Yeah, I mean, as far as the scenic roadways, and this is a long list of roads here, and I mean, some of them, you know, I question why they would be made as such. I mean, I've lived here since I was 5, and, you know, I
Nice,
mean,
yeah.
certainly some of them are not, but like Hoyt Road, Gorham Road, how are those scenic roadways? You know, and I know that none of these are specifically being pitched as such. The idea of having, you know, scenic roads and some regulations, I wouldn't be totally opposed, but certainly not to a list this extensive, you know.
That was presented as examples, possible list, yeah. And the scenic roadway simply says in the byways, you cannot cut trees without a hearing, you cannot remove stone walls without a hearing. So. And state numbered roads are not included in that list because DOT can already do all of that without hearings. So it's just roads within the town.
Okay.
so if, again, there's no need to make a motion on any of these. Just conversation.
Yeah. Yeah. The scenic roads is actually a state law. It exists. And my question is, why isn't Harwich doing it? The other towns are.
All right.
Good. I appreciate the time.
Patrick, thank you, as always.
You'll probably see me again.
I'm sure we will.
Okay.
That's okay.
You and Sky both.
Yep, good, thank you.
Thank you for your patience tonight, Patrick. Of course.
All right. Moving on to 829 Route 28. Deeming the property unfit for human habitation. Violations of 105 CMR 410, minimum standards of fitness for human habitation.
So if you do plan on speaking, if you just want to introduce yourself before you speak, if you just want to sit and listen, you don't need to introduce yourself, but just if you do engage with the board, just introduce yourself. But we are here tonight to deem the property or portion thereof, depending on what the board decides, unfit for human habitation. On March 5th, 2026, an inspection of the property was conducted by myself, the Town of Harwich Building Inspector, and the Town of Harwich Fire Inspector. And it was observed that there were conditions deemed to endanger or maternally impair health or safety, such as no smoke or carbon monoxide detectors. Pathways to egresses were partially blocked. There were large amounts of trash and filth throughout the dwelling, evidence of rodents and other pests, rotten structural components in disrepair, shortage of electrical outlets, no heat, frozen pipes, and other plumbing issues. So photos were provided to the board from that inspection. And your finding, it is up to you whether you want to deem the entire dwelling or just a portion thereof. There are two structures on the property. One is the main dwelling, which has technically 3 legal apartments, or according to the health department records. There's a unit in the back, a unit on the side, and the main unit. And then there is also a cottage, freestanding cottage in the back.
Okay. So 4 potential,
4 units. Yep.
4 units that are there. Now, are these all from the same unit?
These photos are from a series of a walkthrough of the main dwelling.
Just all over the main,
Yeah.
so all the 3 units in the main dwelling?
The recommendation, was going to be to find the entire, all 4 units unfit for human habitation. We did go out and conduct a reinspection of one of the units, and a lot of the sanitation issues were addressed, but I think the building commissioner and building inspector still had some major concerns with there being no firewall between the units and there being a lot of electrical issues and other issues that they did not feel comfortable. They still have an order to vacate. The building commissioner has an order to vacate based on her findings. So this would not be a relief of her issuance. It would just be what the board decides. And then the fire inspector is here as well if you have any questions on his findings.
Any comments, concerns from the 3 of you? You're the ones who've stepped up here.
Don't know what to say. So I'm Christy. My husband is Morgan Hill. He's the head of the trust. He's away on military orders for 6 months, so I'm sitting on his behalf.
Okay,
We do not live at the property.
okay. But this property, from what has been, inspected, is in a pretty serious state of disrepair. Okay.
Oh, I'm Pam Mason. I live at the house.
Okay. And what do you have to say, Pam? I mean,
I know the house is in very bad repair after the last 5 years of having a squatter in my house. I went through all my money and I've had no one to help me fix it up, no way to do anything. And I became a hoarder after I broke my neck and was stuck in the one room for ages. But, I mean, of course I want to keep the house. It's been in the family for,
I mean,
oh my God, 300.
nobody wants to take the house away from you,
No, but
But-
we gotta get it fixed up,
but
I
it's gotta be
understand.
fixed up before somebody can live in it.
Yes, yes.
Okay. Yeah, I don't want to take the house away from anybody. Let me make that perfectly clear.
Yeah.
I don't even think that's what we're here to discuss. That is not even on the table. The
Okay.
concern is the safety
Yeah.
of the people living there, currently yourself, we're concerned about you. We want to make sure that the building is safe for you to stay there, and we want you to be able to retain it. But there are some serious repairs that need to be
Right.
done.
So she's another one of the trustees of the trust. I'm her daughter. My name's Mariah Celine. I'm just a beneficiary of the trust. But I have power of attorney for her. And I wasn't, like, last year, there were multiple people living in this property. I have videos of some of the apartments that were destroyed by one of these people who lived in there for 5 years without paying rent, and the most disgusting thing you've ever seen in your entire life. And we were able to get them out recently. I cleaned out over 50 bags of the trash and everything. That was the apartment number 2. I stopped there and I did not hire a cleaner to, you know, clean the floors and the fridge and all that other stuff. I was waiting to discuss with my brother about who's gonna pay for all this stuff. But that can be cleaned up. I know that it is an extreme mess. You know, I would really like to be able to save some apartments so that she can live somewhere. If nothing else, maybe the back cottage, because it's 1 story. She doesn't have to walk upstairs. You know, I don't know what can be done, but.
So there is an order to vacate for all units through the building commissioner. If the board decided to condemn the dwelling and the cottage, what that would mean is that the property needs to be secured and boarded up until corrections are made. You don't have to return to the board until the full condemnation is to be lifted. We can work with you at the department level to move things along. So if the building commissioner and myself feel that the cottage would be an appropriate place to place Pam once it's in a condition to be
So that
lived
could
in.
be done, like, kind of piecemeal, the cottage could be lifted first?
Yeah, so we can work where you don't have to return constantly until we're ready to remove the full condemnation order. And then same with the downstairs unit, but I would say until there is satisfactory movement as far as the building commissioner is concerned with electrical and structural and all of the issues that she found, we don't have the authority to lift her order to vacate. That would be hers, and then we would work through everything else. Not everything has to be done immediately. It can't be occupied until it's in a condition to be able to be lived in, if there's a finding tonight.
All right, so like if Brian did get the electrical all fixed, so that's no longer a problem in the water.
So I'm not gonna,
Found the leak there.
yeah, I'm not gonna comment on the concerns that were the building commissioners.
Oh, I'm sorry,
Yep,
okay.
no, that's okay. So there was a lot of progress made in the unit where it is sanitary, and his electric in his unit is functioning. But I think there was concerns over the electrical service as a whole and being a fire hazard. There were smoke detectors and carbon monoxide placed in his unit, but they're battery operated, they're not hardwired. So if something happens in another portion of the dwelling, that doesn't necessarily mean that he's safe from injury if.
They have to be hardwired?
They should be hardwired.
Because we've always had the battery ones.
That's, and I'm not gonna speak to the fire code, but as far as I understand that, that's current code. So if there was any changes to the dwelling, you would have to upgrade everything to hardwired 10-year battery backup smoke detectors, so. But in an instance like this where there's multiple units, if somebody falls asleep in one unit with a cigarette, you want those hardwired ones because you want out of the house before that smoke's even in your unit. So, just from my own perspective, that's what I would want if I was living in a multi-unit facility. I don't want to wait until my unit is filled with smoke to get out. But that's, you have to work with the building commissioner to get her ability for him to live there in that unit. We can't say that he can live there even though it's sanitary, because there's further concerns for fire hazards with electrical supplies. So even if the board does say, you know, we're gonna condemn the main dwelling, but the back cottage and the unit 1, we will conditionally find unfit, that would be something that you could move forward where they wouldn't have to come back, that we could just.
All right. So we would find the cottage and Unit 1 conditionally unfit. That would immediately, in the immediate future, necessitate them moving out, being out of there because of the building code. But as that were to progress, if we do it on a limited basis, that would allow them to get back into the dwelling piecemeal as certain units were.
The electrical issues are addressed and the plumbing issues in the rear cottage are
The
addressed.
electrical issues by a bonded and insured and licensed electrician.
That is for the building commissioner to determine, but I am pretty sure that she is looking for a licensed electrician to make that determination and not somebody who doesn't have the background to make that statement. So,
Roger Ling is all right, right?
I don't know Roger, so I don't know.
Around the tape forever.
So, I mean, I think that would be the route that kind of I would be leaning towards currently. You know, I understand it would displace you temporarily at least, but it would also give you an avenue to get back in there as you know, as soon as potentially possible once the building codes are addressed. You have any thoughts on that? Apparently, I think, looking right at you, because you're the one that seems to affect most.
Yes,
Is you're
it
the one
does.
that's been living there now. Does that sound all right with
Sounds
you?
very good, yes.
Okay. Any other specific points, questions, concerns? Even from the fire department?
Brandon, if you
Come
wanna-
on up.
Just introduce yourself too and.
Brandon Farrow, Fire Inspector, Harwich Fire. Did do a tour of the property with Building Health on the 5th. Definitely a lot of issues to address. We understand that it's gonna take some time to fix them. But, you know, it can certainly be done. But right now, I wouldn't feel comfortable with my family living in that dwelling right now. It's just too unsafe. So I think this is the right thing to do. And certainly, we could work towards repairing the cottage and get you in there once those issues are dealt with there, and then deal with the main house. Obviously, you know, a lot of work ahead of you, a lot of work, but as of right now, based on what I saw, I would be very concerned with her staying in that main house right now. Just too many hazards there between just the amount of clutter in there, her being able to get out in the event of a fire, us being able to get in there to rescue her in a fire. Just a lot of safety issues right now.
Any further comments too from your perspective on the apartment 1 even? I know you didn't come with us on the re-inspection, but
I did
just from.
not, yeah. I guess the only thing I would say to that is it is part of the main house. Well, half of it is kind of somewhat separated but still attached. I don't know if that was the bedroom, but the kitchen and I think the living room were directly underneath the second floor of the main residence. So part of my concern with the amount of clutter on that second floor is the weight on that second floor. In the event of a fire on the first floor, you know, it could cause that second floor to
Collapse quicker
to
than it
collapse.
should.
Yeah, prematurely. So between that and the fact that I don't know what the wiring is, you know, situation is between that unit and the main house, we really couldn't get to the electrical panel because there's just you know, too much clutter in front of it. So I'm sure that, as you said, the building commissioner would want the entire house evaluated by a licensed electrician before she would make that determination
Yeah.
to reoccupy.
May I just correct you on one thing?
Absolutely.
The kitchen and the living room that you said were below on the main house, that's not. That's a totally separate house.
Okay.
Just after the Civil War, that was brought up from South Chatham.
Gotcha. Okay.
And it used to be a big.
Okay. But still
But it's-
physically
it's
attached to
connected,
the main
yeah.
house.
It's
so-
attached to it, yes.
Sure, okay. I
But
stand
it's not
corrected. Yep.
underneath it. It's,
Sure.
there's just like a little tiny
Okay.
living room
Yep.
kitchenette up above.
But there are doors that
Yeah,
throughways
they
into,
do,
yeah,
yeah, but I'm just saying
into the
it's
main
not
door.
Yeah, okay.
under the.
But part of the main
Yeah.
residence.
Yeah.
It's not a separate structure like the cottage out back.
No.
All right, I stand corrected.
So if we were to conditionally do it, that would those concerns be taken into account by the building inspector?
Absolutely.
So they could be, that apartment could still be cleared first from the rest of the
Yeah,
main
well, they
unit?
worked on the other things.
So
Yes,
cottage could go first,
but I think the
apartment
electrical,
one could go second, while still the rest of that main dwelling could be worked on?
I think until the building commissioner is satisfied with the electrical findings and the structural issues that may impact that unit, I would not be, like Brandon said, be comfortable with anybody living there until that's cleared. But
Yeah,
as far as
absolutely.
sanitary issues, those have been addressed in that main issue,
Okay.
main apartment, and then the back cottage is in progress.
Okay,
And I think they are the two easiest if we can focus on the safety, the life safety stuff.
I do have one quick question. When the main building gets condemned, does that just mean you can't live there, or are we allowed to go in there and clean?
So you are allowed to access it. We would want notification when you're going over there to clean and make repairs, just so we can, because it should be secured, it should be boarded up and secured. But that's why we want to know. So when we get, reports of people there, we know that you're there for a reason and not just to occupy the space.
And on one of those papers, it said something about March 25th, is that?
The cease and desist order.
So that's the building commissioner's order letter. So that is, let me just review that. Yep, so if you do not comply with the order to vacate by March 25th, then that will start to implement fines, but the finding here tonight kind of reinforces that effective per the finding, it shouldn't be occupied. So her order is to vacate by the 25th, but if we do the finding here tonight, that's kind of solidifies that nobody should be in that dwelling.
And then who do we ask you to give us some time to get the stuff out, or is that?
So you can work on getting things out. Obviously, that would be like with the cleanup and repair and gathering your personal items.
before
um,
March
She
25th?
has her whole life upstairs.
Yeah.
And
So-
I work full-time, like
Yeah, we're not saying that all of your belongings have to be out.
Yeah.
We're not saying that all of your belongings have to be out. But in order to reoccupy, we need it to be in a condition that it's livable again. So we're not saying you have to clear everything out, but in order for you to return, you are gonna have to make some difficult decisions with some of the stuff and where it goes and what's kept and what's not.
Yard sales.
So the stuff does not have to be out, the people need to be out. And we can work with you to get the stuff. And the tenants' things are probably gonna take a little bit more time then. So belongings don't need to be removed, but people should not occupy the space overnight or,
And- but where
hang
it
out during
says-
the day.
Where it says this 24 hours,
That's a different,
that's a different thing. There was another paper that got sent, and I also got no notification of the inspection yesterday or any of this paperwork, so somebody could please
So,
include me.
no, but,
I
so
knew
everything
nothing
has to be
about it.
done within 24 hours?
So I don't know if you got the building commissioner's notice. I think I emailed you a copy of our notification.
Yeah, I did.
I don't think the building commissioner has your contact information, so I can send you a copy of this. And then,
They tried to deliver it, the sign thing. They tried to deliver, I think, the 829, because that's the address I saw on the paper. So if Mom's with you, then she didn't get it.
yep, so we'll,
That would be, it would be totally unrealistic for you guys to be able to do all of that in 24 hours.
That's right.
That's there, it's kind of, that's saying, if you could show us all of this within 24 hours, then we wouldn't have to, have you move out. That's kind of, we had it come up in another case recently where there was already some work, somebody was found in violation of a few things, although those things were kind of already, or at least what we were told, is that they were already, like for instance, a sink that was fully cracked down the middle. Well, there was a sink, or a dry sink, it's still in the box at the building, it just hadn't been installed yet. So they were actively making efforts, that good faith effort within 24 hours to make that correction. So that's, nobody would expect you to be able to do anything in 24 hours. That would be crazy. But that would be, if you were able to show within 24 hours, we could just say, all right, don't worry about it. But clearly, that's not what's going to happen here. Is that accurate,
yes,
layman's terms?
yes. So as
Okay.
far as the full correction, we don't anticipate any of this to be done within
Yeah.
24 hours.
So when they put this down on paper, when we first got the notice, we were getting fined $1,000 a day. And that's when you came in, when you met us here, and so that was like the initial paper.
So, you just said that you're getting, is there a fine involved with this if they're moving out?
So that is a different order for a different set of circumstances. That has to do with drawing a blank on the COI for the building department. They were trying to get in for a number of years and did not have the correct contact information for Pam. So they
So that's
ended up
nothing that
starting
we have
whole fines. Nope,
any
that's the
kind of-
building department.
Okay.
And I believe that Eleanor is working with them now that there's been an inspection. And so that is being addressed in a different department.
Fair enough.
We're just here to, make the finding on the building itself.
So as far as this finding goes, is this a motion that, do we need to vote on this? So, okay. So, I think, discussed it with you. You guys feel it's okay? The board did this, conditional, so it would be a conditional,
So
how are we
you
gonna word
will,
this, Carrie, so we get it right?
you can make a motion to condemn the dwellings located at 829 Route 28 with a conditional lifting of the Unit 1 and the cottage on site with
Once approved by
the building
inspector.
commissioner.
Okay. All right.
The only thing I want to add is, if you have been given resources, for alternate housing, I just want to make sure that you have the resources that you need.
My daughter lives in Dennis, and she's letting me stay there.
Okay, I just think that that's an important piece of this discussion.
So we went down to the community center and picked up a whole bunch of brochures, and
Good.
there is
That's an
a
important part.
possibility that, while we are working to shore up house and get everything back to code and rebuild what needs to be rebuilt, fix windows, whatever it may be, there is, I guess, a program that if she wants to have her own apartment, say like at Pine Oaks or something, there's something that we can apply for through the town.
We can also get you some resources. I think it's the Community Block Grant from the USDA may offer financial assistance with getting some of these repairs made. So
Do you have anybody
I think
adept
I've
in
given
that?
you that information in the past, but if not, I will make sure that that's usually the first go-to for, as long as you stay there, the grant pays itself back, so. But we'll see if there are certain criteria that need to be met to be able to,
Thank you,
yeah.
Karen.
But we'll get you in touch with some.
Okay. If nobody has anything they feel they need to discuss or add in, as far as this conversation goes, I would like to make a motion to condemn the dwelling at 829 Route 28 with the condition that it could be, partially removed, and Unit 1 and the cottage could become habitable upon approval by the building inspector.
I would say satisfactory approval by the building commissioner.
Okay.
Based on her violations.
Okay, so move to have 829 condemned, the whole building with conditional approval for Unit 1 and the cottage, by the building commissioner would allow you to move back in to those specific units, and the rest of the building cleared as we move forward with everything. Second? Vote?
Aye.
Aye. Okay.
Okay.
All right? Okay, welcome.
Thank you.
And I will email you both some resources that will help with.
Email me too?
I don't think I have your email address, so if you want to share that with us, that's why I haven't been emailing you the documentation, because I don't have
You want
that.
it right now?
If you want to share it with
When
me
you're
right now.
lazy, we don't need to keep them. I can talk to her afterwards.
Yeah, We're
You can-
here more
you can-
because of me than anybody else, so worry about it, all right? We can copy an email.
Leave it at our counter, and there's a piece of paper and a pen. Thank you.
All right.
Okay. So we got a few more things on the agenda, so if you wanted to wait.
I can
Yep.
Well, I don't know. She's staying in an apartment in my house. Are there resources to rent the apartment? It's an in-law apartment.
For your house? Let's talk offline about that.
Okay.
I will see what I can look into for that. Yeah,
Okay. I guess I'm gonna look into like the adult day foster program or something. Something like that.
yeah, well, if you want to, I'll
Talk
look.
about resources afterwards.
Yes,
later.
yes.
Thank you.
I will definitely do some research tomorrow. Tomorrow's a lighter day for me, so
Okay.
I'll have an opportunity to look in things that may help.
It's a
Everybody.
full kitchen, living room. It's a full separate apartment.
And if all else fails, you can move in with me and I'll take Sharky out of his room.
Thank you. Thanks, everybody.
Thank you. Thank you, Pam. Brandon, thank you.
All right, next order of business, report from the health director. Gary?
Okay, so our opioid settlement funding, we will be presenting with Crescendo Consulting on our opioid community engagement findings to the select board on April 6th. So tune in, show up, however you want to support us, listen in. I thought it would be best to bring it to the select board, but we will send you the recording so you can watch and get that information as well. We have the third annual Health and Environment Fair. We will be hosting our third annual Health and Environment Fair on April 25th from 11 to 2 p.m. following the Conservation Department's Tour de Trash. located at 204 Sisson Road, not 20 Sisson Road, the Cultural and Municipal Building. There will be health screenings and wellness resources, environmental education, sustainability tips, gardening, composting, and local food information, tick, mosquito, and climate health education, recycling and waste reduction guidance, and family-friendly activities. Our FDA food standards grant, we applied again this grant cycle for the FDA food standards, which we were awarded $15,000 during the last grant cycle to improve our food safety standards. The funding allowed us to upgrade our inspectional equipment, offer specialty training for our establishments, as well as purchase additional equipment in case our establishments are missing thermometers or refrigeration, or to perform hot and cold holding checks. We hope to offer a lot more training opportunities this coming season, so.
When do you find out?
Hopefully in a month or two. The NEHA grant cycle did send us information that funding is again potentially on the chopping block, so they're looking to see what will be funded and what won't. It's a great program for food safety, but we'll see. We applied for, I think, $23,000 for the future grant cycle, so we'll be able to do a lot of training and outreach with that. So,
All right.
it's good stuff, and it allows us to help our establishments reach their goals of hopefully this pile is bigger in years to come.
Yeah.
Very good. Who was that picked, what restaurant was he with?
Bucas.
Bucas.
Oh, okay.
Yep.
Yep.
All right, permits, as listed, new licenses listed below. What is the food establishment at the Cultural Arts Municipal Building exactly?
So,
I mean, that's the old middle school. I don't know what kind of a food establishment is going on there.
so right now, it is just an empty rental space. Our cultural affairs director is exploring all options for use of that kitchen. At this point in time, it is just a permitted kitchen where if somebody wanted to rent it and host a cooking class or, cookie decorating or, something of that nature. So there's no actual food production coming out of that kitchen. It just has to be licensed in order for them to explore what it could be in the future. So.
Okay, so if it were to advance in the future, that would eventually come back. This approval would give them the ability to at least explore options?
So
Open-ended.
if somebody needed their own permit to operate out of that kitchen, that permittee would come. But this just licensed the kitchen, so the cultural center can offer services and events through it, but anybody.
So they could offer like a cooking class or something there.
If Bucas wanted to come in and operate, Italian hour out of the 204, they would need their own permit to do so.
Okay. All right. Any other questions related to the permits? That was the only one I really had. I would then move to accept the permits as listed here.
Second?
Vote.
Aye.
Aye. That's the end of the line here. Motion to adjourn?
Second?
Seconded? Vote?
Aye.
Aye.
Aye. All right.